When is it time for hospice? Hospice is a benefit in the United States that's defined by Medicare, which means you need a prognosis of 6 months or less mortality. Oftentimes it can be longer. Sometimes I've had patients on hospice for up to 2 years. So it's not a cut and dry thing, but generally speaking, a doctor says perhaps without curative focused treatment, the person may have 6 months or less to live. It's different by diagnosis. Typically with something like cancer, we're changing the course of treatment. We're not doing chemotherapy or radiation or immunotherapy. With other diagnoses like Parkinson's or dementia, chronic lung disease, those might be a little bit more difficult to say the 6 months prognosis or not. So it's something that is good to consider with your doctor, to have a discussion. It is an excellent resource for people that are going back and forth to the hospital a lot, getting procedures that are no longer meaningful to them, that it's affecting their quality of life. If it's difficult getting out of bed to appointments, if it's difficult going back and forth to doctors, when there's caregiver burden, that it's just getting harder and harder to take care of somebody that you love at home and you don't have the extra support. It is not caregiving. They will not provide the day-to-day care, but it's an oversight. There's on-call nursing, there's physicians, there's social workers, chaplain, bath aid. There's a lot of resources that can be provided at home. If you have questions, put them in the chat here. Talk to your doctor. It's an excellent resource, and a lot of times people wait too long and they don't really get the benefit of hospice the way if they had started earlier. Most of the patients that I have going on hospice say they wish that they had done it a lot earlier, because it can help so much in relieving the stress, in having good symptom management and support in the home.